During my post-graduation days, I used to tell all my colleagues that you give your projects to me, I will do it for free. If you are a practicing dentist over a period of time, like let us say 10 years, 15 years, or 20 years down the lane, you start, having back issues, neck issues, because continuously you have to do same thing. Right? The day you are expert in doing it, you start charging people for your services when you are doing statistics for them. So data-driven research is very important, and that is lacking in India. I started with $500,
Okay.
and now we have international clients also. So
Hello, guys. Welcome to the latest episode of Rising to the Times podcast. In this episode, we have a very interesting conversation with Dr. Vini Mehta, who is a dentist and has also built a company called Statsense. We discussed about how a research publication is made, the mathematics and statistics that go behind it. We also discussed that how being a professor just does not translate to teaching the students. She also talked with us about how she decided to switch streams and also how she built a profitable business right from the beginning.
Hi, Vinny.
I hope
Welcome to the Rising Through the Ranks podcast.
hi.
To begin with, could you tell us about your journey or more about yourself in brief?
Okay, so currently I'm working as an associate professor in DY Patil Pune Dental College, and I'm also in charge of dental public research cell, and I'm a co-founder of Statsense.
Nice.
So
And
I would like to tell you, yeah,
yeah,
go
please
ahead.
go. No,
Yeah,
I was
so
just going to ask about Statsense and what it does, and
yes.
what the role of the professorship involves, but we can go actually deeper later. Please go ahead.
Yeah, so I started Statsense during my post-graduation days only. Like immediately I completed my post-graduation in 2018. The day I completed my post-graduation, I started Statsense. So when I was doing my master's, we had a guest lecture from a professor who was working in AIMS. So he had come for a guest lecture, and he was telling us about how research works, how statistics help researchers, help doctors, and academicians. So he was telling me that there's a good career in this, and you can explore in the research domain. So during my undergraduation days, I had done my undergraduation from Savangi, the Tamigi University, Varda. So after first and second year, when I completed my first year and second year, I realized that I'm not interested in dentistry. Basically, this monotonous thing, every day you screen the patients, then give them treatment plan, and then do treatment, and ultimately after 4 years or 5 years of graduation, you start your own clinic. So I thought I want to deviate from this and do something else. Now after taking up, I thought that I need to complete my graduation anyhow, but what next? So this was my question. So for this, what I did was I took up my internship in GDC Nagpur. So there I gave myself one more year. Even after 4 years in dentistry, I gave myself one more year. Okay, let's try. If in this 1 year, if I develop the interest in dentistry, I'll go ahead. Otherwise, I'll figure out something what needs to be done. So because in GDC Nagpur, the flow of patients is too much. Like compulsorily you have to do 10 to 15 patients in a day. That is how it works, and there is no escapism. So I thought that let's try and I gave myself one more year, and I explored all 9 branches in dentistry. So there was one particular branch which I liked most, that was public health dentistry, where, we had to go for camps, and we did not treat one patient. We treated the community, and we were more focused on prevention part rather than treatment part. So before the disease starts, you prevent it instead of treating it. So I liked that branch, and why I liked it, because I thought that yes, you get this outing every day. There is a camp, you get to eat there, you get to meet new people, and just have fun and come back. So that is how I liked this branch. And other branches, same, how you treat patients. They come to the OPD, you screen them, and then you give them treatment plan and treat it. So that was for other 8 departments, but this was a different department where you have to go for camps. So I thought that now I am not interested. Even after giving 1 year chance to myself, I did not like. And one more thing I notice is that if you are a practicing dentist over a period of time, like let us say 10 years, 15 years, or 20 years down the lane, you start having back issues, neck issues, because continuously you have to do same thing, and there are ergonomic problems also. So I thought that this is not my cup of tea, and I don't want to play with patients' life. So I will just take up something else. So during my undergraduation days, I did not know what how like which other branches are there after dentistry, what needs to be done. So I chose this branch where we had to go for camps, and that there was more of prevention kind of thing instead of treating patients. So that is how I took up for my master's program public health dentistry. So after taking up this branch, I realized that it is not all about camps. It is about research. It is about biostatistics. Now, because you have to mandatorily do dissertation. So during my post graduation, I realized that now I have to deal with this other aspect of this subject as well. So when it came, like, biostatistics is a very important role in public health dentistry. Good at maths during school. To escape maths, I took up medical branch, and now again, circle of life. I had to deal with mathematics in biostatistics. So, but then during my post graduation, I learned research thoroughly, and the best part I understood is like how we did maths in school days. It was completely different. Now with softwares, you can do it. I don't have to calculate anything. I don't have to apply any formula. And with just number of clicks, you get the results, you get the output. So I started enjoying doing that. So what I did was during my post graduation days, I used to tell all my colleagues that you give your projects to me. I will do it for free. I will do your statistical analysis report for free, so that when I am doing my post graduation, I have 3 studies to do. So other than those 3 studies, I will not know. I will not have experience to it. So if I explore more, I will get to know. And my mentor, my professor had told me that the day you are expert in doing it, you start charging people for your services when you are doing statistics for them. So that is how I started my journey. And I completed my post graduation, and I was very popular in college because I used to invite people that you come, you take help from me, I will guide you, I will help you. And I was a newbie, I did not know anything. I used to go to medical college because I did not get enough help in dental college. I used to go to medical college department, community health, and I used to ask those professors how to do for this study, for that study, for my friends. And that is how I learned statistics, and everything I learned from YouTube. Because those days when my professors were there, they had done post graduation 10 years, 15 years back then, and they did not know softwares. They did everything manually. So this was a self learning journey for me. So when I completed 3 years of my post graduation, I was in my library and I was thinking that what next? What should be done now? So that same day, I started Statsense. So my co-founder, Dr. Ankita, she suggested this name, and in just 10 minutes, we got this name and we started the company.
Nice,
So
nice.
Yeah, that is
Also,
very interesting. Yeah, Ashwani, you were asking something.
can you explain a bit about what exactly comprises of in biostats and how you do it and what all
yeah.
softwares you use?
Yeah, so there are 3 things. There is this biostatistics. We like when I started with helping students only with statistics part. But now, after 4 to 5 years, now we have different things. Now we help with protocol writing. We help students with research. We help with grant writing. We help with publications, and we even train students. We mentor them. We train them. So biostatistics is related to healthcare statistics, and you have seen in stock market also there are statistics. You see the mean and standard deviation. If you're good at statistics, you can predict in stock market also. So we deal with biostatistics, that is healthcare related statistics.
And what do you predict?
And
Like, who is more prone to disease, or what exactly?
yeah. So there is mandatory, when you enter post graduation, there is mandatory dissertation which you need to do, and some short studies also. So you have a hypothesis that whether if you put this intervention, whether there will be a change or there will be a no change in that. If you take some drug, whether it will be effective or it will not be effective. Okay, so this we give it to patients, and then whatever results we get, we analyze that, and you know the p-values. We see whether there is a statistical significance. But now there are statisticians from maths background also, but they will not be able to interpret the results in clinical background. So there is a difference between clinical significance and statistical significance. But we, being from healthcare background, we can interpret the results as well, clinically, how effective it is. So that is the difference. And the softwares which we use, to begin with, I started with SPSS. That I think you guys also must be knowing.
No. What is it?
SPSS. I think during your post-graduation, when you take up MBA, you will learn SPSS because that is mandatory for everyone. Now we have shifted to then there are paid softwares also like Stata, SAS. Those softwares are also there. So now we deal with a bigger data. When I started my journey, it was like, only my juniors and my colleagues and my seniors would approach me. And that was only restricted to one college where I was studying. Then slowly it expanded. And if you have seen on social media, I don't do much of marketing, not even my website or social media handles. So everything is about mouth publicity. If you do one project successfully, they will recommend 10 other clients. So we have expanded now, and we take care of pharma companies also. We deal with government projects, healthcare startup companies also. And recently, I've completed my MBA from BITS Pilani. So now we want to enter the hospital sector as well to know the healthcare economics, finance.
So all of these, like, what is the use case for all of these companies? Like, all of them are doing testing/trials of drugs, and they are using Statsense. I'm not able to.
Yeah. So for pharma companies, they deal with drugs. They deal with interventions also. Okay. But for other healthcare startups, now, for example, I'll give you one startup which we did a project. They have invented a smart stethoscope. Okay. So they want to test this in 3 different areas like urban, rural, and semi this area. And after checking that smart stethoscope, they have this readings. And there are 2 things. Now with that stethoscope, they will check, and manually also they will check. Like a doctor will also check. Now you have to see the after they test, they will have the findings, they will have the results, how accurate it is. So it is not just about drugs, it is about other things also. There are health systems also. Now during pandemic, you must have seen there was a lot of infodemic, lot of information was there. But was that information reliable? Because during pandemic, we analyzed a lot of data, which not just hospitals carried out studies. Like for example, one study was on vaccine hesitancy. We tested. Then there was this demographic details of the patients, and with their comorbidities we tested. So all of different kind of studies from hospital, from students, from private researchers, all those kind of studies we have analyzed, and we have given the reports. So with this evidence, you can bring some change also in the society, in your community.
Correct.
Right.
So data-driven research is very important, and that is lacking in India.
Absolutely. So like when you start, like you mentioned about the research and authoring papers a bit, right? So like what's the process involved in like that side of things? Like if I want to do a research in a specific thing, say vaccines or something, how can someone go forward with it? Like what's the process?
Okay. So now if you have a topic in your head and you want to do a research and how you want to start it, so if you come to us, we will guide you right from the protocol stage. How to develop the protocol, then acquire funding for your project. And there are a lot of CSR funding, government funding is there. So we will help you with that grant writing and budget preparation as well. If you get certain amount, let us say 10 lakhs, how will you prepare your budget for that? How will you divide the sources? And then data collection will be from your end. You will have to collect the data. You'll have to go to field and collect the data. And once the data is collected, if you share that data with us, we will help you analyze the data, interpret that data. And then out of that, preparing the report and making a manuscript, an article out of it. And once this is done, the best, like once the research is done, the outcome is in the form of publication. Publication is very important. Only then the world can read your project, and they can replicate your study and use the product or the vaccine for it. So in this case, now for the authors, if you have just come to me for guidance or for consultancy, I will not take authorship in it. But if I have done substantial work other than statistics part, also if I have done substantial work, then I may ask for authorship also. And the people who have done, like, before you start any project, you have to decide on what will be your team, what will be the contribution of each member, and based on that, the authorship position, and that will be decided. Now if you see some of the publications in high impact factor journals, so you will see a senior most person who is a professor will be the last author and the corresponding author, and he will also act as a guarantor of the research, and corresponding to the this. So if you take up this research job, it is not 9 to 5 job, because you don't have to just give your comments and then it is done. When you submit your paper, you will get a lot of queries from the journal as well. So you have to address those queries, and first round of revision is there, second round of revision, third round, and then the acceptance will come. So that process is involved, and we help the clients with that part as well. We are there till the outcome is achieved, which is in the form of publication.
Also, do I have to be like a postgraduate student or
No,
or enrolled in a university to be a researcher, or can I, in my capacity, also do that?
no, absolutely no. So this people think that who are in academics can only do research, but research can be done by anyone. We I've seen now during in school days also, people have started, young minds, and they have started applying, because now the education pattern is also changing. If you see, now it is more of problem solving based learning, instead of question answer thing. So research is what? A problem which you have to solve. Okay, so if you are from IT background, if you like let us say, if you want to write something on cyber security, or if you want to give hacks, or if you want to give the safety precautions, so that you can write a paper on it, like a literature paper. And if you want to do a original study, then you have to collect some data or retrospective thing. Now I had seen on my gov there are a lot of competitions organized by Modi ji. So he gives this, that whoever solves this problem or does this will get a prize money.
Okay.
So that is research.
Right.
And on this client part, like, how did you get your first paying clients? And like, what was the pitch to them?
So the day I completed my post graduation, so now I was like, now I can start charging. Though I was not an expert back then in 2018, but then I thought that now I've completed, now I have the degree, I can start charging people. So the first client was my junior itself. She wanted some help, so I started with $500,
Okay.
and now we have international clients also. So everyone in my college, they knew that I was good at statistics part. I was good with the research part. So they would come with their studies, with their protocols, and they would ask me that what should be the study design, what should be the sample size for the project. So for sample size calculation also, there are softwares, and you need adequate sample size to replicate your data. There should be valid and reliable results. So
And these
sample size
data they got like themselves, or they went through some government repository for like whoever is looking to research. Where do they find this data?
Yeah, so there are three things. First is, you have retrospective data. So these days, they have recently started now, when pandemic started, they started putting all the data on government websites. So if you see WHO website, CDC website, there are data on, different viruses outbreak. Like when there is a rainy season, they'll give you the data of, dengue, chikungunya, all those sorts. Then there was this recent outbreak, monkeypox. So even that data is retrospectively, you can get it from the website. And so this is retrospective study, where you take up secondary data and you analyze it and publish the results. Then the second is original research. Original research is where you have a research question, and you go on field and collect that data. You laboratory also, if you have two interventions, you check that intervention. And third is, there are already published articles. So that from those published articles, you collect about one particular topic and give your own conclusion. So that is evidence-based research.
Got it.
So different types of study designs are there, and based on those study designs, you have to collect the data.
Got it. Now talking about your journey as a professor,
Mm.
can you tell a bit more about it and how do you prepare lectures, courses, and everything around it?
Yeah. So after my post graduation, I had two options. First was whether I should go for academics or whether I should go for research part. So I consulted a lot of people, and I thought that this again, this academics is a 9 to 5 monotonous job. So I went with Indian Institute of Public Health, IIPH Gandhinagar. So it is semi-government. They get lot of funds from government to do research, to solve the problems. Then they have CSR funding also. Then they have private and government funding. So I was appointed for a government project. So my PI was working parallelly on 3 different projects. So she was working on nutrition, maternal and child health, then water and sanitation programs also. So I was appointed for DBT grant. So those grants are in billions and millions, and she was having CSR funding also. So during that time, what I realized was this is a government project and it will go on for 5 years. So they had this intervention also, and parallelly 2-3 different projects. I realized over there they hire people like my designation was senior research fellow. So they have senior research fellow, biostatistician, junior research fellow, then lab technician, and they have to give them monthly salary for these projects, and for 5 years it has to go on. So I worked there for let us say 6 months, and then 6 to 1 year, and then I realized that instead of working for somebody else, and this government have to pay salary on monthly basis. So instead of that, why not my company provide services where when this data collection is there, we will do the data cleaning part, and then we'll analyze the data, because this is a very raw data which they have taken from different parts of Gujarat, because I was based in Gandhinagar. So data cleaning is also important. So instead, the government has to pay salary on monthly basis for biostatisticians or data collectors. My company could offer them these services as. So I quit my job and I thought that let's start working on these lines. And that is how I focused on my company for 4 years. I built it up, and we have team members. But the best part is, here in my company there is 0% investment, because everything is online. I just have to share the report, and I already have the softwares. So when they share the data, they do I analyze and send them the report. So for 4 years I was focusing on my company only. Then I realized now, if you see, there are ranking systems coming up. You see there is NRF ranking coming up, then there is Times Higher Education ranking, QS ranking. So this year the list is released, and there are 148 Indian universities which are in global ranking, QS ranking system.
Yes.
So how this ranking system is? Through number of these research projects, publications, and citations. People cite your papers also. So with this, this is a very unexplored area. So after 4 years, I was called by my alma mater. That I was already doing good. I was helping all the professors in my college. While when I was a student, I used to take their help, but then when I passed out, everyone used to contact me. And especially my branch is very interesting, because we don't need help from other clinical parts, but all other clinical researchers, because they are more into clinics, they are more into treating patients, so they don't know the basics of research, so they have to come to us and take our help. So I was already helping all the professors in my college, so that is how they approached me. Would you like to join the college and help with the research part? We need more papers from you. We need you to train our students, our faculty members. And I took up that thing also, because there is a rat race now. People don't do quality research, they need quantity research. And and what, according to me, I like, it should be, the research should help somebody, to solve problem. Like, it should help at least stakeholders or policymakers, government officials or clinicians or academicians. not just sake for your profile or for the publications. But for institutions, they need grants also, and the grants will come. And grants is also one of the parameter which decides the ranking. So currently, where I'm associated to D.Y. Patil Dental College, that is the third best university in India according to the Indian ranking system. And we have recently entered international ranking also. So in Asia also, we have managed to secure the position. Now we'll be competing against the world ranking. So for this ranking system, they wanted some good researchers, to join the institution, and that is why I joined academics. But people think that I have to take, lectures for students. I don't take lectures for students. I just take lectures on research methodology part, biostatistics. I teach them softwares, and now AI has come, so it has completely changed, the way you perform research. Initially, it used to take about 15 days or 20 days to write a paper. Now it has become very easy, but still human touch is needed. I see students, they take help of Grammarly, and they just they have stopped using their brains. They take help of Grammarly, and they for the is or also they use that. But human touch is very important. So my journey as a co-founder of Statsense, and my journey as a professor, it goes parallelly. So when I do my company work or when I help professors, it indirectly helps the college also. So it is a win-win situation for me and for the college as well. Otherwise, if I did not have my company, if I did not come from a research background, I would be sitting in one corner as other professors, and I would also be an ordinary thing. But now, from my past 5 years of experience, I can guide them, I can help them, because I have international clients, I have international researchers contacts, because they were my clients. So I have taken them, and now they are attached to the college as adjunct faculties also. So they put our college affiliation as well. So this is one added advantage for me. So it goes parallelly and side by side, to answer your question.
And how do you manage time between these two things? Or again, is that also very like not problematic for you? This
So
professorship and running a company.
yeah. So when I started my company after 2 years, I saw students during internship and after internship, they wanted to go abroad. And if you want to go abroad for higher studies, you need a good profile. You need publications, because there are certain exams in healthcare sector where you need good profile plus. With good profile, you need publications, and you need some grant and citations on your published papers. So I started mentoring students. I don't charge students. I have seen a lot of on LinkedIn. I see a lot of companies or this researchers who have this mentorship program. So in this thing, what I was thinking was, I will get volunteers who need publications for their projects, who need recommendation letters from us. From as a professor, they need recommendation letter. As a company, they need recommendation letter. So I would guide them for 1 year, 2 years, whatever period they are comfortable with. They will co-authorship the paper with me, and they will have 2 to 3 papers in that duration, and I will be giving them a recommendation letter, experience certificate as well. So kind of internship, or if they want to continue with us further, they can do it. So in this is my model, of working. We have a lot of students who have joined us, and now I just have to supervise, monitor them, and I guide them. And I have prepared my own modules also. Those modules are there, and I tell them that this part you have to read, and this practical part you have to do. And I will provide you access to the softwares. You learn the softwares, and the best part is, it is just self learning, because I did everything on my own, and with practice you learn. And the best teacher is, if you read manuals, and if you watch some YouTube videos, you can learn the softwares as well. So that part, they need to do it self-learning. Technical part, the design part, the theory part, I teach them. My modules are already there. So I guide them. So I just now supervise and monitor them.
Understood.
And I don't even have to pay, because they are volunteers, and they work as their projects are there.
Yeah, that's very smart also actually. uh,
Yeah,
Thank you, Vinny. So I think we are
yeah,
done with our main questions. So we really got to understand professorship, statistical analysis, how we built a company out of it. But we also have a set of like five rapid fire questions. So one
yeah.
line answers for each question, just quick, fun questions.
Okay.
So very simple. Like, what is the best part of your? I mean, now we can call it professorship, running a company. What is the best part of doing all this?
The best part is when I see that I'm on the other side of the table now as a
Okay.
professor.
Okay.
Right.
Got it.
Then one thing you'd like to change about your work.
One thing, I work in different time zones, so I want to have a set because my clients are from abroad. I don't now much take Indian clients, so I want to change that.
Got it. And you touched upon this, but can AI take over your work over a few years, or like how do you see that?
No, AI will never replace the work of a researcher, but AI will definitely help the researchers to save the time.
Hmm.
Now there are some tools where I don't need to read the article. Like reading article will at least take 20-30 minutes, but with AI they will just mark the keywords, important keywords, and I will know the gist. I will know the result part of that,
Right.
and AI will not replace humans.
Yeah.
Got it.
What is that one missed opportunity that you wish you could get a second chance at in your life?
Yeah, so I wanted to go abroad to pursue some courses, but now I feel that that is not a missed opportunity. I will develop my own courses for students,
Hmm.
here.
Nice.
And for PhD, I wanted to go, but now I will do PhD from here because low income countries has the maximum data, and I can help. Like I call myself as a budding social change maker. So with
Hmm.
my research, it should help the society. It should help the government.
Got it.
Right.
And like, what's an alternate career you would have chosen if it was in medical, for example? Uh,
um, See, during my time, it was only medical or engineering, and I was bad at maths, so I thought only medical is the option for me. And I always wanted MBBS. I wanted to pursue MBBS, but then my scores were low during this PMT. Now, the NEET has replaced PMT, so I have never thought about alternative career now.
okay. Got it. Thank you so much, Vinny. I think this was
Yeah.
very, very helpful.
Thank you for
Please,
watching the podcast till the end.
if you have any questions or doubts for the guest, please let us know in the comments.
एंड इफ यू थिंक कि कोई क्वेश्चन बहुत इंपॉर्टेंट है डू लेट अस नो ताकि वी कैन फोकस मोर ऑन द एस्पेक्ट नेक्स्ट टाइम
और आप लोग थैंक यू मत कहिए, इंस्टेड 3 लोगों से शेयर करिए और उन तीनों से कहना कि और 3 लोगों से शेयर करें, दुनिया बदल जाएगी।